cyfle, because I fod yma i siarad unwaith eto yn y cynhadledd. Thank you very much for the opportunity of being here once again to speak at this conference. You've heard already that just 12 months ago, and in this very room, we talked about prudent healthcare as a set of principles and ideas that we would look to develop and apply here to meet the future challenges of the NHS in Wales. When I look back over 12 months, I really do believe that we have had a remarkable success in generating that debate, in taking the idea from something that was known only to a few keenly interested individuals to a topic that has been so widely discussed and disseminated here in the Welsh Health Service, but far beyond it as well. It's now an idea that we don't just talk about ourselves, but we read about it in works that are published by others. We see it in the BMJ, in the Lancet very recently. Yesterday's report by the Nuffield Foundation highlights it as well as a set of ideas which, if, and as Helen said, we can take them from the page and make sure that we are delivering them in reality, then we have made an amazing start on that journey over the last 12 months. It is genuinely distressing to read of the number of primary cancers which are diagnosed in Wales during post-mortems. It's the first time that the health service ever knew that somebody was suffering from that condition. So we know that under-treatment and the challenge of the inverse care law remains real in Wales, while at the same time, and across the health services of many nations, we have also witnessed the creeping medicalisation of everyday life. The proposition that there really is a pill for every ill, and that every setback in the human condition can be rendered amenable to treatment. And in the international debate which we are part of, this has emerged as a discussion about overdiagnosis and over-treatment. Overdiagnosis takes place when someone is diagnosed and treated for a condition which is unlikely to ever cause them harm. The BMJ puts it in this way when they say that overdiagnosis is a significant threat to human health by labelling healthy people as sick and wasting resources on unnecessary care. This is the very opposite of the prudent healthcare principle of harm avoidance, because it leads, as the BMA go on to say, to too many people being overdiagnosed, overtreated, and overdosed, overdiagnosed, and over-treatment. And those of us who have turned on the radio this morning will know that this very topic is live in debates today, with NICE publishing its latest guidance on asthma diagnosis, suggesting that while there is underdiagnosis of asthma still in the population, up to 1 million UK adults may be taking drugs on a routine basis that do them no good at all, and in the process is likely to be adding actually to harm. Now, that paradox is something which I think prudent healthcare helps us to find a way through, and it helps us to do it in this international way. So concerned has the BMJ been about the phenomenon that it has launched its own Too Much Medicine campaign, and I recommend its website certainly to anyone who hasn't seen it and who is interested in the latest news, research, analysis and debate in this area. It really is an excellent source for us to draw on here in Wales. Begin by re-emphasising to us the opportunity that we have here in Wales to be at the leading edge of this new international movement, making sure that the future healthcare of patients here in Wales is shaped not by those barren comparisons between one bit of the United Kingdom and another, but by drawing to the benefit of Welsh citizens ideas, developments, new ways of doing things that are catching light right around the globe. So here is how the £70 million is going to be deployed. £10 million of it will be set aside to accelerate the adoption of new technologies and new ways of working which drive efficiencies in our healthcare system. £10 million will be invested in our key national delivery plans, those plans which respond to major clinical conditions here in Wales: cancer, cardiac, diabetes, stroke, mental health, and so on. 20 million of the 70 million will be devoted to supporting the continuation of those schemes and projects with a demonstrated record of success and which have been developed in partnership with our local authorities through the Intermediate Care Fund, and to take those ideas further. And £30 million, the largest slice of all, will be invested in our primary care services. So that's how I think, through Welsh Government, we are able to provide financial backing for this first key priority for prudent healthcare over the next 12 months. And of course, the action to make a reality of a prudent primary care-driven NHS does not stop there. We hope very soon to conclude a further round of negotiations with GPC Wales to build on the success of what we were able to achieve jointly in contract negotiations last year. At the end of this week, the 3-year plans from each of our trusts and local health boards are due to be presented to the Welsh Government. We will look very closely at those plans to see the ways in which they reinforce our key commitment to shifting activity from secondary care and into community and primary settings. We will look at the way in which those plans bring together the 3 essential strands around which they are structured, those of finance, service, and workforce planning. And in doing so, that brings me neatly to my second priority area for 2015, and that is the remodelling of our workforce here in Wales. The more that I have thought about this whole matter, the more I have been convinced that the achievement of a prudent healthcare system depends upon reimagining the workforce that we will need for the future and deploying our most precious resource, the people who work for it, according to that prudent healthcare principle which insists that no one should routinely be providing a service which does not require their level of clinical ability and expertise. So my third priority for 2015 is to keep up the impetus in the remodelling of the relationship between those who use our health services in Wales and those who provide them. I've talked in front of many audiences over the last 12 months about the need for us to create a more equal set of relationships in which patients are allowed to make the contribution which only they can make to their own health and well-being. And I've tried to be clear as well as a set of new opportunities, such a remodelled relationship would bring a new set of responsibilities for all of us as citizens to contribute to our own future health. I know that sometimes when we talk about prudent healthcare, the cultural shift that is involved in it sometimes seems like the biggest challenge of all. But there's some very good news, I believe, on all of this, because I think the public are already ahead of us on much of this agenda. Many of you will have seen that on Monday this week the BBC published a poll of public attitudes towards health here in Wales. It showed unambiguously that the public already expects that the health service cannot be expected to be held responsible for actions which lie much more in the hands of others, and the Confederation's own poll, published as part of the conference, clearly underlines all that as well. Let me be very clear though as well, that there is nothing in this for me which is about a culture of blame, nor am I attracted to courses of action which result in those who are already the most disadvantaged in our society becoming still more disadvantaged. But the need to avoid avoidable harm is urgent, and a genuine sense of co-production is by far the most effective way of bringing that about. 2015 needs to be about continuing that conversation, sharpening it up where necessary, and being prepared for the difficult moments it will undoubtedly produce. And where at individual and at health board level, you as practitioners have those challenging conversations, then as Minister, I want you to know that you will have my backing, because I believe that this already represents the collective view of citizens here in Wales.